Hello, you guys. It's me, Lexi. I am back for day number 15. I had to double check 3 times. Now, welcome back to my channel. If I have any welcome backers, welcome to my channel. If you are new, my little baby infant channel. I'm just here to talk about life in general, working in healthcare, working in mental health, being a mom, being a single parent, being a woman in general. How about that? But today I am double irritated. One, I made a car video. I made a very good car video. Change the scenery, doing my thing. Just to get home, again, no sound. So either my car is gaslighting me or my T-Mobile or someone even wants me to get a new phone. I refuse. It's paid off. So you have to to stop working. Anyway, the second thing I'm upset about, I've been upset about for a very long time, is health insurance. The one thing that can actually be bad for your health. And I don't even know where to start. I don't know where to start. I had notes, left them in there. I'm too lazy, or I may or may not be too lazy to go get my notes. But health insurance has gotten out of hand. They've stepped outside of their lane. Matter of fact, they're in oncoming traffic at this point. They are the ones dictating our health to a degree, to a very severe degree. And people are suffering because of it. I know some private insurance or commercial insurances, they do pay for more, but a lot of times you have to meet your deductible on top of making your payments. And sometimes you're still not going to cover something, even with the commercial insurance. But you know what's ironic? Like I tell Blue Cross Blue Shield, who, depending on which one is good or horrible, I say it's funny you don't cover that because you seem to cover my paycheck every 2 weeks. You cover that very well. You don't miss a beat, not even a heartbeat. You cover that like nobody's business. But when it's time to get some of that back for our health, you may or may not cover it, mostly not. So that's my rant on some things. But I work in community mental health, addiction recovery, have a homeless population. A lot of them have state insurance. A pretty good portion is starting to have commercial insurance. And since April 1st, managed care started, they're not managing our care. And it is really getting to me mentally. It makes me very upset. Sometimes I lay my head on my desk and just breathe. I will have angry tears. I won't cry, but my eyes will get watery. Because a lot of these people, they work their butts off. They pay into this, insurance thing just to get no help. Some people, do or don't, whatever, but a good portion of people pay their dues. And when they're due for healthcare, decent healthcare, I'm not even saying good, decent, no. And being in community mental health, it's humbled me in a lot of ways. But this health insurance is out of hand. Since managed care started, I've had to take more than one is too many, but I've had to take a lot of people off of their medications that were keeping them stable. They had a job, being a productive member of the, society. Got their families back, able to be with their children or stop self-medicating with drugs and taking care of their mental health. Imagine having to walk them in and say, hey, we know you're doing well, you're doing awesome, but your insurance no longer wants to cover your med or your injection. And we're going to have to find some alternatives, which we probably already tried before. We know they didn't work, which is why we ended up where we are. But your insurance deems it not worth being covered. Your mental health is not worth being intact. Then the states and, some other entities wonder why mental health is such a bad thing, why there's a lot of homeless and drug use. On one hand, trauma or one thing to another leads to use, whatever. But taking people off their mental health meds and making it where they can no longer function and work. And they're like, oh, well, I'm going to go self-medicate, make the voices go away, kind of chill out my temper, depending on what you use. Some of it exacerbates it. But because I can't get help otherwise. And it's bad enough. Well, it's not bad enough that you cut the funds for mental health every year, twice a year, whenever you feel like it. But you're going to go do managed care, which we all knew was going to be a horrible thing. And you're not caring for them. Managed care, but you're not managing to care for the people. And at this point, I'm thinking a good Board of Health insurance is bad for your health. I don't want to keep telling people, hey, your injection is no longer covered. Or, hey, they're not going to pay for this pill because, it costs too much. Let's try all these other pills that are going to give you horrible side effects. You're going to hate it. And let's just see what happens. You probably already tried it, but let's just go back around and see if your body forgot you tried it and see if it works this time. Which every now and then it does, but not often enough. And it is frustrating. I'm sick of every day, several times a day. This med isn't covered. This injection isn't covered. They're not going to cover this. Oh, it's covered, but they have to pay $400 or $500. Community mental health. I wouldn't even be able to pay that. I think it is crazy. I don't call the insurance companies. I don't say, hey, don't approve Joe Schmo because he pissed me off this morning. Or, hey, approve my best friend Sally because she's my best friend and why wouldn't you approve her? I don't bother y'all. I don't bother them. But somehow they seem to just finagle their way in my life, our lives. Some providers leave the state because, Oklahoma's not very high on the list of places to be with healthcare. Oklahoma is one of the worst states to be as far as healthcare, actually, if we're going to really be honest. It makes it hard to take care of people when you're backed against the wall or into a corner because insurance won't cover this. We've tried all of these. These you're allergic to. And, this group home doesn't want them on this medication because, or they need better instructions. Or if they do cover med, it has to be certain quantity, only for XYZ. It's like all these stipulations. And I'm over it. And some people say, well, why don't you do private practice? A lot of people have, private or commercial health insurance. And I could do private practice, but that's not going to help the other people without it. And I am burned out. I am so burned out. And I see why providers leave or they stop or do whatever because it's so frustrating and you can't do anything. They literally make it damn near impossible to take care of your patients. Like literally. And if I did concierge medication or medicine, I have to have a physician over me because I'm a nurse practitioner. But you can just do like subscription. They can pay a monthly fee or what have you, but you still have to deal with their insurance. Are they still going to cover that med? Maybe. Most likely not. So the only person to be halfway winning would be me getting money for me to see you and you to most likely not be able to get your medicine. So I don't see that as an option. I don't know. And you wonder why people go postal. Because you won't let us take care of them. Or not even mental health. Let's talk about physical health. Why, I know why there's a wait, like 4, 5, 6 months, over a year, because not enough providers. We got this managed care. People have insurance, hoping to get taken care of. Some people are so happy. They're looking forward to finally getting a doctor. And then your insurance says, you have this disease, this eye problem, but we're not going to cover the treatment. But just so you know, you have this disease. So, bye. And then when they do, they cover a little bit. Patients will come out of pocket. Or we're not going to kick in and give you this treatment to help save your life until your heart functioning is at 14%, if you're lucky. we're not going to kick in and, help treat your chronic kidney disease until you get like 5% functioning. Their goal is to help you die. Literally, they want you to die in hopes of not having to take care of you, not having to treat you, because that, costs too much money. And why would they do that? Your job is to pay into the pot and have not. There we go. I'm hilarious. I'm so funny. I am. But I am frustrated. And I don't know what to do. It's like, dang if you don't, dang if you do. And instead of being proactive, insurance reactive if they're active at all. That's all I can say. And I don't know what to do. I mean, I'm only one person. We could go lobby, do all this stuff, but at the end of the day, they do what they want. You can get some bills passed, but until they have less say so into your life and your care, it's not going to work. I guess there was a point in time in life where you could just like prescribe someone something and they just get it, simple. And I wish more places understood that sometimes you have to spend money, sometimes a decent amount up front, in order to make money. To gain, that revenue back, you kind of have to spend money. Instead of trying to save money, put people on pills that don't work and pay for all these other pills, even though they're cheap. When you're doing that for a lot of people, it's actually not cheap. And then when you're paying for their inpatient stay because you didn't want to take care of an outpatient, you're going to pay for that too. Don't even get started on that because, they'll pay for your inpatient stay for like a certain amount of days. 5 days, 7 days, 10 days. But when your days are up, you got to go. You got to get out. They don't care if you're still actively suicidal. Your days are up. You got to go. Like, sorry to say that word. Hope you just get mad. But I can just blurt that out, I guess. But they don't care. They don't care if you're ready to discharge or not. You're going to go because your days are up. And that hospital's not going to cover your stay. So, good luck with your mental health. We tried. I would say it blows my mind. It doesn't. It only gets worse and worse. People are not getting good health care. We've known that for so long, but I didn't think it could worsen. And the audacity to say, oh, we're not going to cover that. You're not sick enough. We're waiting for you to kick the bucket. Okay. But you know what? I'm sure their family and friends are very well taken care of, because they're millionaires and all, probably billionaires. And it is what it is. Well, actually, it's not is what it is, but they're going to come to a head. Everything has a limit. And I don't know. I feel like we're really near it. I do not like the feeling telling the patient, we're going to take you off your meds and see what we can do. I went from getting a lot of stuff covered, which, yes, it costs money. But do you want, what was I thinking? Healthy people do not make money. They don't. They don't make money. If you're healthy, you're actually costing them money because everyone needs us to work our butts off, the little worker bees, stay stressed, stay under all this tension and pressure so we can get all of this, what is the word I'm looking for? Not homeostasis, we wish. Anyways, to get our cells all out of whack, and then we're rushing, we're anxious, we're depressed, we're irritable, getting hypertension, all these other things, because that's the way they want us to be. Then you go and get all of these ailments, and you get all these pills that they may or may not cover, which are going to have you try all these other pills that they know aren't that great for you. Then they're not going to cover the better pills. Because why would they cover that? The better stuff. Because they need us sick. So it's just like this whole thing. On one end, pharmaceutical companies win. On one end, insurance wins. It's like, quid pro quo. Give a little, take a little. But at the end of the day, healthy people don't make money. And unhealthy people, like when you're healthy to a point, you're not making no money until you get to a point where you're unhealthy. Let me run through my head. If you're healthy, you're hurting pharmaceutical companies. And if you're too unhealthy, you're hurting the insurance companies. So they have to find like a little, Dad, you're it, Dad, you're it. So we all know it's about the bottom dollar. But it's not a bottomless pit the way they think it is. Sorry, I should have closed the blinds because I am nosy. I'm like a discreet Karen. But guess what? I am neighborhood watch. Just the ones around me. And I look out for my neighbors. Hey, it's late. They don't usually have their garage door open this late. It's getting dark. I'm going to go tell them because I don't want a weirdo walking into their house. That's what neighbors are supposed to do. Supposed to. And we look out for each other, like boom, 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 boom. And if your mailbox thing is open, I close it because I don't want anyone to look into your mail, But we do look out for each other. That's how it's supposed to be. But golly. And I'm fortunate to have commercial health insurance, even though they don't cover everything. Or get this, my daughter's speech therapy, they didn't cover it. Or they said, well, we will, but you have to pay $75 each visit. Well, I'm paying $65 directly to the place. So what's the point? It's $10. And it was still $75 at the place because I got $10 discount for just using my card. Or, yeah. So they really weren't covering anything. They just want you to think they are. So it makes me so sad. It makes me angry, frustrated, disappointed, depressed, anxious. And I'm already all of those, mostly. But it's just a look in their face when you say, hey, I have to take you off their medicine. You just see like panic, anger, or just like this fear. It's like, oh my gosh, what am I going to do? So, I don't know. I guess until it hits closer to home for them, they're just going to keep not caring. So, there's that spiel and vent for today. But it is day number 15, and that's pretty cool. I made it. I was embarrassed to tell friends and family. Now I'm kind of like, hey, can you subscribe? Tell your like friends, grandma, and all them to subscribe, whatever. If you want to. Now, I don't want people just fluffing if they don't want to. I don't want to feel forced. But I can't believe I made it this far. Even though I'm venting about health insurance or non-health insurance that you still have to pay for. And that kind of ties into, I want to buy a home. I want to be a homeowner, But I'm even afraid to buy a house because you have to have homeowners insurance and they can just jack up their rates or do whatever they want and they know you have to have it. And that kind of freaks me out. I don't trust any insurance. It's all a scam. For the most part. Like 95% of it is scam. Well, I'm gonna say it. I'm gonna say it nicer because I don't want you two to hit me. Those are very throat punchable offenses. Throat punchable. And that's put in a nice way. Throat punchable offenses. I have a lot of things that I could say, but that's the best I can do. So, I guess we just have to pull together and tell the insurance to stop being. But anyway, it's Friday. Hope y'all have a wonderful weekend. I'm going to try to pick up and I don't know what else I'm going to do, but I'm doing it. Probably going to sleep. I'm still tired. I think I'm still tired from that Benadryl. I might make 2 videos tonight. But I'll talk to y'all later. And see you after a while. Crocodile. I cannot say crocodile. Not crocodile. Crocodile. Is it the Oklahoma in me? Crocodile. Bye.